If someone says that they believe they were born in the wrong body, that is what it used to be called, you have a medical diagnosis of something called gender dysphoria, because no one is born in the wrong body. You're born a man, you're born a woman. A tiny, tiny, tiny percentage of people are born non-binary. That's not what we're talking about when we're talking about trans. Someone believing they're born... It's a different thing.
Sorry to interrupt you, Julia, but it's interesting that you're citing biological facts from a widely discredited metaphysical view of the human body. We know that the human body isn't just our physical organs. We know that we have a complex relationship with our mental phenomena. You study philosophy. Think back to your metaphysics lessons when you were learning about this.
Innes, there is nothing controversial for 95% of people in this country, but I would think 99% if they really had to be pushed on it, about whether or not your being male or female is a biological fact and is a physical fact. So people are born what they are, and they remain that for their whole life. You can cut things off, you can do other things, you can take as many drugs as you want. You will remain biologically what you are from the day you were born. You're not assigned sex. Your sex is what you are born and what you are created as. Okay,
and as I said, you're citing biological facts based on a discredited...
It's not discredited, darling. It's biological truth.
Very complex body.
This is where we start from.
Phenomena
if we can't,
physical organs.
If we can't even start from
the very
biological
conversation we're having just now is exchanging ideas. It's mental phenomena, and the relationship we have with our physical organs is complex.
Okay.
If you can't accept that, you're denying reality.
Yes, and I'm probably transphobic for it as well. I'm not denying reality. That's the reality.
What I said to you, but
how
you're denying biological facts.
You feel inside is completely different from the reality of your biological body and your chromosomes.
Well, how do you explain pain? How do you explain the sensory experience that we experience with pain, which at times falsely experiences what's wrong with our body?
Innes, we've got 3 minutes left. Can we talk about the actual subject at hand? Okay. You say these are
but this is the crux.
Innes,
it's not the crux of it.
Innes, it's not your podcast, darling. I'm asking you.
Reality.
I don't know why I even bother. You can't. I mean, let's deny the reality of 2 + 2 = 4 as well. I mean, we can argue about that, but it's a waste of everyone's time.
You're citing a widely discredited medical view of the human body.
It's not discredited. Needless medical I'm still trying to ask the second question. Needless medical processes, you say. They're not needless. Someone who's got gender dysphoria needs to be given a lot of psychological help. I don't believe that certainly 16-year-olds should be given any sort of medical treatment, because we know how damaging that can be. Ability to decide to be infertile for the rest of your life, I think, is something that a 16-year-old is not equipped to do. But when the Scottish Government doesn't have these powers, equality legislation is reserved for the Westminster Government. The Westminster Government is entitled to slap that down, and when that impacts on women and girls in particular, the risk to them in their safe spaces, they're even more entitled to slap it down.